Hi, my name is Christen Hopkinson, student number 3527837, and I am in Cedar Valley College's Distance Education Veterinary Technology program for Fall 2020. Okay, so the first position that I will be demonstrating today is a dog in lateral recumbency for a lateral saphenous venipuncture. So lateral meaning away from the median of the dog, which would be the middle here. So it would be the side. Recumbency is the act of lying down. So lateral recumbency is having the dog lie down on her side. So the first thing I need to do is get her down into a sitting position. So what I'm going to do is safely restrain the head, release my hand from under her belly, and scoop it under her bottom to get her to go into a sit. Good girl. Now while restraining the head with my one hand, I will switch to this hand and put it under her mandible. Move my hand over top here. It's okay, you're fine. Good girl. And get her to safely lie down. So I will put my one arm across her neck there just to keep her head down, make sure that her back is pressed against my body, and hold both of her front legs with my hand, my one index finger in between. So the saphenous vein, the lateral saphenous vein, is located proximal to the hock and distal to the stifle and runs down in between here. In order to occlude this vein, I will hold with the palm of my hand just above her stifle and gently apply pressure. This will get the vein to pop up and the technician will be able to draw blood. Once the technician is done drawing blood, I will let go of my pressure and cover up the area that was punctured by the needle in order to ensure there is no bleeding or bruising that takes place. So I will just hold off for a short while there. Once I'm finished with that and make sure that there is no bleeding or anything taking place, I can safely get my dog back up into a sitting or standing position. So I will take the hand that was dealing with the hind end before, put it around my dog's mandible there, release my dog's front legs, and gently scoop under her neck to restrain that. Then I will scoop my other hand under her body and get her back up into a standing position. Good girl. So the second position that I will be demonstrating today is a dog in sternal recumbency for a cephalic venipuncture. So sternal meaning on her belly, recumbency meaning the act of lying down. So sternal recumbency is having her lie down on her belly. So what I'm going to do is safely restrain the head and hold it to one side to ensure no one is able to get bitten. Then I will release my hand from under her belly and get her down into a seated position. Good girl, holding her against my body. So I'm going to release my other hand, still supporting my the head with my other hand. Slowly move it under her body and get both forearms down so that she's in a lying position. Good girl. Then what I'm going to do is gently hold the head over to one side to ensure that the technician does not get bitten. Move my other hand out under her elbow to support that and move it forward. So the cephalic vein is located in both forelegs and it runs cranially along the border of the forearm over the top here. So in order to occlude this vein, I will hold the back of the elbow here with my thumb over top and gently squeeze and roll it over to the side. The vein will then nicely present itself for the technician so that they're able to draw blood. Once the procedure is complete, I will then put my thumb and hold off on the area where the needle punctured the skin to ensure there's no bleeding or bruising that takes place. Once I've done that for a short while and we've made sure that the bleeding stops, I will release the pressure on her forearm and gently take my other arm and scoop it under her belly to get her back up into a standing position. Good girl. Okay, so the third procedure I will be demonstrating today is a cat and lateral recumbency for medial saphenous venipuncture. Lateral meaning away from the median of the body, so to the side. Recumbency is the act of lying down, so lateral recumbency means she will be lying on her side. In order to safely get her into this position, I will put one hand in front of her chest and grab her front legs, sliding my hand to the back of her neck and gently lying her down. I'll use the back of my hand and the back of my arm to support her. And when she's calm and relaxed, I will release the front legs and gently grab my hand back to grab the tail and back leg. Good girl, it's okay. So that the technician can pull the leg out. So the medial saphenous vein is located to the inside of both hind legs and can be seen here. So in order to occlude this vein, I will apply gentle pressure so that the technician may draw blood. Once the technician is done drawing blood, I will then release my pressure and hold off in the area where the vein was punctured to ensure there is no bruising or bleeding taking place. Once that is done, I will release pressure and the technician will release her leg and I can get the cat back up into a safe seated position. Okay, so the last position that I will be doing today is a cat in sternal recumbency for a cephalic venipuncture. So sternal meaning on her belly, recumbency meaning the act of lying down. So sternal recumbency is the cat will be lying down on her belly. In order to get her safely in that position, I'm going to support her chest, take my other hand to grab both forelimbs, and gently guide her down into a lying down position. Good girl. I will then support the head over to one side and put my arm behind her forelimb to stretch it out for the technician so that they're able to access the forearm. So the cephalic vein is located in both forelimbs towards the cranial part of the forearm, so along here. And so in order to occlude this vein, I'm going to put my thumb over the top and roll to the outside to get the vein to present itself for the technician. That technician will then draw blood, and once they have completed such, I will release pressure and hold off on the area where the skin was punctured, just to ensure there's no bleeding or bruising taking place. Once that is complete, I will release her forelimb and get her back into a safe sitting position.